Hello everyone and welcome to Making It on Mondays. Making It on Mondays is brought to you by the Acupuncture Pregnancy Clinic, which is an integrative traditional Chinese medicine clinic and an acupuncture clinic dedicated to reproductive health, to IVF support and to pregnancy care. Now these weekly sessions are designed to help and support those on their fertility journey and are all about empowering men and women who are trying to conceive through providing weekly workshops with relevant and research-based resources. And in these weekly sessions, we cover topics such as TCM fertility, nutrition and mindset, and we also share tips from the experts both inside and outside of our clinic. Today, I'm your host, and for those of you that don't know me, my name is Louise Jeffrey. I'm a traditional Chinese medicine practitioner, an acupuncturist and a coach, and I've been in practice helping couples trying to conceive since 2010. Now, today we're going to talk about male fertility, and I'm going to share our top 5 tips for improving sperm health. But before I start, I just wanted to give some context and I wanted to share some statistics with you. What we know from research is that 1 in 5 Australian couples have troubles trying to conceive. And we also know that male infertility is a contributing factor in approximately half of these cases. Now, the startling truth is that the average male sperm count has dropped 45% from around 113 million sperm per mil to 66 million sperm per mil in 1990, right? So we know that the number of men with low sperm counts in the same period has tripled. And what this means is that the average sperm count of a 30-year-old today is about a quarter of what it was in 1925. Now, the cause of the stark decrease appears to be an increased exposure to environmental pollutants, either during the time in the womb or later in life. Now, research also tells us that the pregnancies of the partners of men that are exposed to environmental pollutants are also affected. And we know that these pregnancies experience high stillbirths and premature delivery. Now, to me, those are really startling statistics. And it may seem rather doom and gloom when you listen to them. But the great news is that with some lifestyle and other changes, which I'm going to discuss in more detail today, for a lot of men, things can change for the better in a really short period of time, in just 4 months. So what determines sperm health? I'm just going to touch briefly today on the parameters of sperm so that you can understand what they are and how they're impacted. Now, we know that sperm health depends on a number of factors, but the 3 factors that we're going to discuss today are quantity, movement, and structure. So number 1 is sperm count. Now, this is really just how many sperm there are. Men are most likely to be fertile if their ejaculate, which is their semen that is discharged in a single ejaculation, contains at least 15 million sperm per milliliter. Now, if there's too little sperm in an ejaculation, it might make it more difficult to get pregnant, okay, because there are fewer candidates available to fertilize that egg. So that is sperm count. The number 2 parameter is motility. Now, this is really the movement of the sperm, because for the sperm to reach and to fertilize an egg, sperm have to move and they have to wriggle and they have to swim through a woman's cervix, through her uterus and her fallopian tubes, up the fallopian tubes to get to that egg. Now, you're most likely to be fertile for a man if at least 40% of your sperm are moving. That's considered acceptable. Then the last parameter after count and motility is morphology. And this is really the form or the structure of the sperm. Now, normal sperm have oval heads and long tails, which work together to propel them to get to the egg. Now, whilst morphology is not as important as a factor as sperm count or motility, the more sperm you have with a normal shape and structure, the more likely you are to be fertile. So we want to have a certain percentage of abnormal forms. Okay, we don't want to have too many abnormal forms. So what causes issues with count, motility, and morphology? And those 3 parameters are what your IVF or your fertility specialists are going to be looking at if they do, a sperm sample. There are a number of factors that cause issues with count, motility, and morphology. And these factors contribute to these parameters being outside of their limits, right? So sometimes the cause of low sperm count is actually unknown, but some possible causes that we know to be true include things like hormonal imbalances, trauma to the testicles. So if people have had sporting injuries, for example, undescended testicles, even those that were repaired when the man or the boy was very young. Another one is a varicocele, which is really just an enlargement of the veins within the scrotum. Not unlike varicose veins that can appear in our legs, but just in the scrotum itself. Another factor is orchitis, which is inflammation of one or both of the testicles, and this is generally due to infection. Other factors can include sexually transmitted infections, difficulty with ejaculation, certain medications, and then the other thing is prior surgeries. Now, the other thing that can play a role is age, because the ability of sperm to move and the proportion of normal sperm tends to decrease with age. And this can affect fertility. And it's generally, for men, it's normally after the age of 50 that this starts to happen. But those sort of factors that I've just talked about are generally out of our control. But there are a number of factors over which we have more control. And these are the most important ones. And I'm just going to talk to you briefly about those today, because this is where men can make the biggest impact. And here they are. Number one is alcohol. Now, there's no doubt that heavy alcohol consumption has a negative effect on sperm count and function. Okay, research has told us that. But mild to moderate drinking, so of around 2 to 5 units per week, seems to do no harm. Except, of course, if you have a hot constitution, and your acupuncturist will advise you if this is the case. And then we're going to tell you to avoid drinking alcohol altogether, because it's a stimulant and creates more heat in the body, which is not good for sperm. All right, another factor over which we have control is smoking. Pretty much all the studies that have looked at sperm and smoking have shown that smoking tobacco or marijuana has a harmful effect on sperm. Another factor is coffee. Now, a little bit of coffee is fine for most men, but too much, which is more than 2 cups a day, has been shown to damage sperm DNA. And again, if you have a hot constitution, we're really going to tell you to avoid coffee altogether. Another factor to consider is weight. We also know that a high BMI is associated with decreased testosterone and increased estrogen, neither of which are good for a man's sperm count or quality. Another factor which we get asked about a lot is sex. We know that frequent sex improves the quality of the sperm in an ejaculate, whilst a few days abstinence actually increases the quantity of the sperm. Now, as a woman, if you know when you ovulate, then sex daily around this time is recommended. But if not, then it's advisable to have sex every second day from when the period finishes and continue for 10 days or more if you have a longer cycle. All right, another factor is fumes, chemicals, and toxins. Now, this is a big one. We know that men exposed to chemicals or fumes at their workplace have lower sperm counts and poorer morphology. So we always recommend trying to limit exposure at work and at home and going with more natural products when you can. Yet another factor is stress, and this is another big one. Because stress is endemic in our society, those of you that are on your fertility journey will know, you'll be very, very aware that infertility causes stress, and in a cruel and vicious cycle, stress has been shown to reduce sperm quality. So that's why we spend so much time talking about stress management, stress reduction, making sure we have enough time each day to relax or exercise and to make sure that you get enough sleep. All right, then moving on to diet. What do we know? We know that too much sugar in the diet and eating a diet too high in artificial additives, colorants, and flavorings can negatively impact our sperm quality. The next factor I want to talk about is clothing. The manufacturing of sperm really works much better at cooler temperatures. And that's why the testicles are actually carried outside of the body. So we generally tell men, to avoid wearing tight jeans and tight underpants if they're trying to conceive, to be on the safe side. All right, our second to last factor is exercise. And if you're trying to conceive, we generally say avoid excessive cycling or prolonged overheating. Obviously, it's still important to keep up regular exercise, but you don't want to get too hot for too long periods of time. And then lastly, but not least, is mobile phones and laptops. Now, some reports indicate that electromagnetic radiation, or EMF, from mobile phones is associated with hormone changes, and that long hours of use is associated with reduced fertility. So it's best not to keep your mobile phone if you're a man, or even if you're a woman, but if you're a man, in the side pocket of your trousers, as that's really, really close to the testicles, and try to limit the use overall if you can. All right. Our next question is, what's the best way to produce healthy sperm? The great news is that you as a man can take simple steps to increase your chances of producing healthy sperm. And I'm going to share with you now our top 5 tips for creating healthy sperm. Actually, there's 6 because I really felt like there was one that I couldn't leave out, but I'm going to share those with you today. Number 1, and this goes without saying really, our first tip on creating healthy sperm is to eat a healthy diet. Now, we know that foods that are highly processed and full of additives and preservatives are not helpful for sperm production. So choosing plenty of fruit and vegetables, particularly organic if you can, where possible, and choosing foods that are rich in antioxidants is going to go a long, long way to helping your body to produce healthy sperm. Number 2 in our top 5 or 6 tips to create healthy sperm is to reduce stress and ensure healthy sleep patterns. Now, we know from research that high levels of cortisol and adrenaline, which are stress hormones, can decrease sexual function, and they can also interfere with the hormones that are needed to produce sperm. So if your sperm is suboptimal and you're stressed, ideally you're going to be doing whatever it takes to impact your body's response to that stress by practicing meditation, by getting your body back into the relaxation response. You might want to take walks in nature. Perhaps you want to reduce your work hours. Perhaps you want to see a counselor. Whatever it is that helps you to counteract or reduce stress, you're going to need to find out what that is for you and start to include that in your life. Number 3 in our tips is to get moving. Now, what we know from research is that moderate physical activity can increase our levels of powerful antioxidant enzymes, and those enzymes help protect the sperm. Just remember, like I said before, to avoid excessive heating of the scrotum, and don't wear sports clothes and underwear that are too tight, like cycling gear, for example. Number 4 in our tips to create healthy sperm is to reduce your exposure to chemicals, pollutants, and toxins. And for me, this is one that, you can get stuck in and you can really make a big difference straight away, in your home. So it can be in your home, at work, or anywhere else that you may be where you're exposed to chemicals, pollutants, and toxins. And this is also going to include reducing your alcohol intake if necessary and stopping smoking if it's a habit for you. Number 5 on our tips to create healthy sperm is supplements. Now, seminal fluid needs high levels of antioxidants to protect the sperm from oxidative damage, right? Because, as I said to you, things like chemicals, for example, or heat can create oxidative damage to sperm membranes and to DNA during their 64-day development. It takes 64 days for sperm to develop. So things like zinc, vitamin E, vitamin C, CoQ10, selenium, fish oils, carnitine, they've all been shown to have an association with improved sperm quality. So if you have had a sperm analysis, which has been suboptimal, then speak to your naturopath or your integrative medicine doctor to run some blood tests for you and check your levels and see if there's anything that needs supplementing. All right. Then the last one on our top tips to improve sperm health is acupuncture and Chinese herbs. So what we know about acupuncture and Chinese herbs is that they can be very helpful in improving sperm health. There have been a number of randomized controlled trials and pilot studies that have looked at the effect of acupuncture and of laser or electrostimulation of acupuncture points on sperm quality in men with low counts and with poor motility and poor morphology. And these seem to show a benefit. And what we're focusing on with the acupuncture, with the herbs, is improving blood flow to the testes, reducing stress, and regulating the hormones. And by doing so, then we are impacting the sperm. Now, what we've seen in our clinic are some amazing turnarounds with sperm. Sometimes within a few short months, you're talking 3 to 4 months, we've really seen sperm samples improving, particularly on the motility and morphology front. Which is really going to make a big difference in improving your chances of conceiving. So a lot of people ask us as well, when is it time to seek help? When do I need to do a sperm sample? Well, what we know, and as you've seen from the session, adopting healthy lifestyle practices to promote your fertility and avoiding things that can damage it, can really improve your chances of conceiving. But if you and your partner haven't gotten pregnant after a year of unprotected sex, then it might be, or 6 months if you're a little bit older, then it might be worthwhile getting a semen analysis. And a fertility specialist or your GP can request one of these for you. I think that's it for now. I hope that was helpful for you. I hope I haven't gone on too long. For more detailed and resourceful info on anything IVF, fertility, or pregnancy related, visit our Facebook group or our Instagram, or sign up to our mailing list at acupuncturepregnancy.com.au. That's it for now. Bye.